Lori Wallace joins us live to tell us more.
Hey there, guys. Good morning. Don't you just love Ringo Starr having his little checkup this morning? What is Ringo here for today?
So Ringo's mom is concerned that his ear is bothering him. So she brought him in so we can take a look for her.
Okay, and so Ringo had to come in, obviously, by himself. They're limiting the number of people that are actually coming into the vet hospital. So Dr. Rhoda, you're going to talk to us a little bit about this. That's Alicia. That's Mom over there on the computer saying hi to us. You have this set up in a way where the pet parent can still be a part of the appointment without coming in.
We do, and as veterinarians, we like to celebrate what we call the human-animal bond. And you can imagine it's a little bit difficult to do that when the owner is outside the hospital and their dog or cat is inside the hospital. And so we've been able to utilize telemedicine in a way that allows the owners to be present for the exam through an app on their phone and be a part of the experience and not feel like they're missing out on what's going on with their animal.
Yeah, and it's a really easy concept here, the way you guys have this all uploaded and ready to go. Talk about how this works between the doctor here and the person on the computer that we're seeing there, Alicia.
Yeah, so Alicia's just out in her car in the parking lot. We send her a notification through an app on her phone, which she clicks, and she can live video in for the exam. The doctor can talk to Alicia in real time through the app. She can see what's going on, she can hear what's going on, she can ask questions, and the doctor can ask questions of her.
And we talked a little bit about this last hour, how animals can be seen right now for emergencies and things like that. There are some cases where you can see these animals for different things, and also if someone is in a situation where they can't leave home at all, that you can still include them in this process.
Yeah, so telemedicine works even when we're a bit more limited in what we can do, and so there are certain circumstances, however, where we're able to take care of things remotely from home, and so if there are any questions about how we can do that, the best thing to do is to ask your veterinarian.
And also coming into this building right now, a lot different. You have things set up a lot differently. We touched on this last hour, but just let people at home know if they're planning on bringing their animal to their vet, how it's going to look different for them during this time.
Yeah, unfortunately, you're not going to be able to be physically present in most veterinary hospitals, but this is one method to take care of that. You know, whether you're able to come in remotely or not, you have to be understanding that veterinary hospitals patients just as much as you love your pets, and we're grateful that you're here and we take care of your animals just as we take care of our own animals.
Okay, well, let's get a quick check on Ringo. How's he looking down there?
Well, Mr. Ringo's being an excellent patient, and I am concerned about his right ear, Alicia. So I'm going to go get my otoscope so we can take a look down deeper inside and see whether or not he's got an ear infection down deep inside. And then we'll get him medicated for you and get him home with you.
Love that. You guys, isn't this cool? Thank goodness for technology, right? Yeah. Ringo's going to be just fine. He's going to be just fine.
Glad to hear it. Awesome. Thanks, Lori. 8:14 here. If you are